Hello, everyone, and thank you for joining today's virtual educational program with Cancer Support Community Los Angeles. I am Edlyn Rodarte, and I am the program coordinator at CSCLA. I'm excited to welcome you to this week's webinar titled, What Can Palliative Care Do for You? Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you'd like to learn more about our services or watch past webinars, please visit our website at www.cancersupportla.org. Before I introduce today's speakers, please note that we cannot see or hear you. Your video and microphone are automatically disabled for this webinar. We will have the chat open for this webinar, and if you have any questions, you can use the chat to enter them at any time. Questions will be answered throughout the presentation, and if any are left over, we can go ahead and also answer them at the end. We might not be able to get to all the questions today, but if our presenters are invited to share their contact information at the end of the presentation. Without further ado, I'd like to welcome today's speakers. The first is Lindsay Waters. She is an LCSW in the inpatient palliative care social worker at Ronald Reagan UCLA Medical Center since 2016. She graduated from University of California, San Diego in 2011 with her Bachelor's of Arts in Psychology, and from the University of California, Los Angeles in 2014 with her Master's in Social Welfare. She interned at the Cancer Support Community Valley Ventura, Santa Barbara during graduate school. Lindsay received a post-MSW certificate in palliative care from Cal State University Institute for Palliative Care. Her clinical interests include integration of wellness and debriefings in the healthcare system, social work integration and physician-learner feedback/education, and palliative care community outreach. Our second speaker is Delia Cortez. She is also a licensed clinical social worker at Santa Monica UCLA Medical Center for 15 years and has been part of the palliative care team since June 2016. Delia has completed specialized palliative care training through the CSU Shirley Haynes Institute that includes the Advanced Palliative and Hospice Social Work certification. She recently graduated from the Postmaster's Leadership Fellowship Program through NYU Silver's Zelda Foster Studies Program. In addition to her palliative care work, she enjoys providing clinical supervision, mentoring others, and teaching. The third speaker is Dr. Stepanyan, and she is currently a palliative care provider at UCLA, both in the hospital and clinic setting. In addition to patient care, she is invested in medical education and serves as the program director for the Palliative Medicine Fellowship. Welcome, Lindsay, Delia, and Dr. Stepanyan. Thank you so much for joining us today. You are able to turn on your videos and your camera when you're ready and begin screen sharing when you're ready. Thank you.
Thank you.
Thank you for having us.
All right. Can you see this okay? Lindsay and Delia, maybe you can give me a thumbs up. Okay,
Yes.
Wonderful. Well, welcome everyone. Thank you so much for joining this webinar. We are going to be explaining the field of palliative care and how we can help patients and families that are living with serious illness. And we do want to start by normalizing that palliative care is a relatively new field. A lot of people don't know much about it. Even a lot of healthcare providers might not really understand the full scope of what we do. And so we hope to teach all of you more about that today. And we hope to do that through sharing real patient stories to give you a really kind of tangible sense of how we can help impact the lives of our patients and families who are going through serious illness. At the end of the presentation, we'll also be sharing resources for how to access palliative care and how to ask for a referral. We do encourage participation throughout, so please don't hesitate to put questions or thoughts throughout in the chat, and we will get to them as soon as we can. We might not be able to get to all of them, as Edlin mentioned, just due to time constraints, but we'll do our best.
So first, we want to start out with what is palliative care. And what we're hoping for is for anyone to write in the chat of what they think palliative care is, what's their experience with palliative care, what are their, what do they feel when they hear the term palliative care, what comes to their mind. So we're going to allow some time to see if anyone has any thoughts about what palliative care is. I see someone wrote used before hospice care. Great. So I see that some people have experience, sometimes about pain, symptoms, soothing pain, muscle problems. A couple mentioned about before hospice and how it can be both for any time of treatment, for pain, emotional pain as well. And again, like Dr. Stepanyan said, it's okay if you didn't know this, as you're here to learn about this. And so if you're not participating, that's fine, because the goal of this talk is that we can talk about what is palliative care and include that in this discussion. Okay, so maybe we can go to the next slide and how we define palliative care.
Sorry, not advancing. Not advancing with my keyboard. Let me try it this way.
So to us, palliative care, it's an extra layer of support to make living with serious illness easier, both for the person and for those who help care for them. So an important piece that we always want to make sure our patients know is that we're not just for the patient. We're there for the whole family. And sometimes that means whoever the patient defines as their family. That could be friends, caregivers, loved ones, somebody who they're related to by blood, or they're maybe not. So that's how we view ourselves and how we want to support patients and their families. So how does palliative care work? This slide emphasized three main points. First, that it is a team. It can happen at any stage of illness. And I see that somebody put that in the chat. It can happen right when someone's diagnosed. There's no right or wrong time. We happen at any stage of illness. You don't lose your doctors. That's something that we see a lot of patients are really scared about when we get involved, that we're going to come in and be a new team. And we work alongside your doctors. We work with your doctors, and we're an additional consultant team. And one thing to remember is that the team can look very different at many different sites. So this slide shows the core members of a team. Sometimes it's a doctor, nurse, social worker, a spiritual care provider, but some places they may only have a doctor. And the goal is for it to be a full interdisciplinary team, but just note that you might run into a team that only has a physician. And then other places may have more of a more developed team, and they may have additional services like music therapy, child life, psychologists.
So how will this team that Lindsay was describing, and again, it may look different in different settings, help you? The first main way that we can help is with quality of life. Every individual differs in terms of what is important to them. It's very specific and a personal definition. So it is really important for your palliative care team to get to know you as an individual to best optimize this for you. And as Lindsay was mentioning earlier, also your family. This extends to how you define family or the support system that's involved with you. But in general, we help with quality of life through improving physical symptoms such as pain, nausea, constipation, shortness of breath, and anxiety. Helping to manage and improve these symptoms will help people to have more time at home, if that is what is important to them, and also improve quality of life through addressing the emotional and psychological burdens that can sometimes be a really huge contributor and compound the stressors of living with or caring for those with a serious illness. And now we'll be presenting two real patient examples of how palliative care helped with their quality of life. We have Laura and Sean. We want to reassure you that while these are two real patient scenarios, they have been de-identified, meaning to ensure their privacy, their names have been changed, different photos have been used, any specifics that would identify them. And we really want, as you listen to these scenarios, as you hear their stories, we really encourage you to think about what comes up for you as you hear from Laura and Sean, and put it in the chat. Are there questions that you'd like to ask? Does this provoke some thoughts and feelings that you'd like to share as we're moving through these scenarios? So first, Laura is a 72-year-old woman who has enjoyed her retirement until she noticed she was having trouble keeping up with her friends on their walks. She went to her primary care doctor and then a heart specialist who found out that she had a silent heart attack. A few weeks later, Laura had another heart attack and ended up in the hospital with heart failure. In the next slide, we'll hear from Laura and her story.
A nurse, Nicole, came to see me in the hospital. Nicole explained that she was a nurse on the palliative care team, which meant focusing on helping people live well, even with a serious illness. Nicole asked what was most important to me about my care, and then arranged support that I didn't even know existed. She gave me medication for nausea, helped me talk about my illness with my grandchildren, and put me in touch with a social worker to provide support to my husband. A few weeks after palliative care became involved, I was finally starting to feel normal again and back to enjoying many of the things I used to do.
And again, any thoughts or questions, reflections on Laura, please feel free to write those in the chat. Sean is a 56-year-old gentleman who was diagnosed with stage 2 oropharyngeal cancer or throat cancer. He was undergoing chemotherapy and radiation when he developed severe pain in his throat every time he swallowed. He was referred to palliative care. And now we'll hear from Sean.
During my first visit with the palliative care provider, she asked me about the things that were important to my quality of life. I shared with her how important it was for me to get back to work in the military, to eat the foods that I wanted, and to participate in Camino de Santiago in Spain. Over the course of the next year, I met with my palliative care team every 2 weeks to a month. With adjustments to my pain medications and with their support and encouragement, I was able to start eating some of my favorite foods again and was eventually able to return to work part-time. Recently, I even completed part of the Camino de Santiago.
You'll note, and I want to highlight from Laura and Sean, that they were able to benefit from palliative care. The team was able to gather what was important to them, what brought them meaning, and develop a plan that would support that. So Laura, for example, became aware of the additional supportive services from the interdisciplinary team in her case, available to her and her family, that allowed her to improve her quality of life. And for Sean, he really benefited from the expertise of pain medication, pain management that the palliative care team has to offer, as well as the emotional and psychological support. So this allowed him to reach his goals of eating, working, and also completing part of the Camino de Santiago.
When we talk about palliative care being an extra layer of support, in addition to helping with quality of life, one of the other main ways that we can be helpful is actually in assisting with communication with your other physicians. I have patients tell me all the time, whether they're dealing with cancer or some other serious medical illness, that the amount of care coordination can be incredibly overwhelming, and that sometimes they feel like they're getting mixed messages from their doctors, they're not getting a clear sense of what's going on. And so one of the main ways that I can help is actually by streamlining some of that communication, getting patients the information that they deserve to feel informed about their care. I also, as palliative care physicians, we generally see patients more frequently, especially if we're managing symptoms. So most patients I see monthly, sometimes even more frequently than that. And the benefit is that we can pick up on changes in their health conditions that might be concerning and really be proactive about it and get a plan in place. So we will hear from, again, 2 patients where in particular the palliative care team was helpful in assisting with communication with their other doctors. And once again, feel free to post any thoughts or questions in the chat throughout. We will start with John, who is a 22-year-old man, physically active, was working as a stuntman in movies when he was diagnosed with lymphoma. And during his treatment for lymphoma, he developed a problem with chronic recurrent infections in his abdomen. His palliative care doctor was working to manage his pain with different medications to really help him continue to be as active as possible while he was undergoing treatment for his cancer. So we'll hear from him now.
One week, my pain started rapidly worsening. I was having trouble getting clear guidance from my doctors on what to do. My palliative care doctor was concerned about the worsening pain and got a hold of all of my physicians, the surgeon, oncologist, infectious disease doctor, and made a plan to get an urgent CT scan to figure out what was happening. This coordination with all of my doctors allowed the team to figure out what the problem was and intervene with a simple procedure in clinic so that I didn't have to go to the emergency room or be admitted to the hospital. I felt really grateful for this additional advocacy and support.
And now we'll hear from April, a 70-year-old woman who was starting to recover from back surgery for her sacral chordoma, which is a type of bone cancer, when she started to feel worsening pain. Her palliative care doctor tried to adjust her medications, but she was not improving.
Because my pain was worsening, despite multiple changes to my pain medication, my palliative care physician voiced his concern to my orthopedic oncologist, my medical oncologist, and my spine surgeon. They worked together to get me admitted to the hospital right away. To my surprise, they found a pelvic fracture. I had surgery on my pelvis the very next day, and I was able to go home a week later with barely any discomfort.
Someone wrote, I like John's testimony. So I'm glad to hear that that resonated in some way with you. I think what stands out for me about these two cases is just, again, the sheer number of specialists involved, how overwhelming it can be for patients to reach out to all these physicians to get everybody on the same page sometimes. And that because of the palliative care team's proactive involvement and close communication, in one case, we were able to avoid a hospitalization for John. And in the other case, although she did have to be hospitalized, it really allowed us to expedite her care plan and get her this really vital surgery that I think without our team's involvement might have taken a lot longer to kind of be discovered.
Another way that palliative care can help is in support and guidance in making important choices. With having a serious illness often comes a ton of information and choices that patients and their families may be presented with. And sometimes our patients don't know that they have choices, and this is really normal. And it's something that we as a palliative team always want to help our patients with, is helping them speak up and know that they have a say in their care, and that there are choices that impact your life, your well-being in different ways. And another thing is we understand and we try to talk about is how treatments only work if they work for you. And this is something that the palliative care team can help patients and their families navigate. So again, we're gonna hear from two different patient examples, patient stories. And again, if you have any thoughts or reflections, please put them into the chat. First, we're gonna hear about Elizabeth and her partner. So Elizabeth is 65. She was diagnosed with multiple system atrophy, a neurologic illness that led to weakness and difficulty breathing, eating, and talking. Prior to her illness, she had a very active life as a personal trainer, and she wasn't sure how she would feel as her body changed and became weaker. She didn't know if she would want to go through procedures to try to keep her alive longer, or if she would want to focus more on her comfort. It felt overwhelming trying to navigate the benefits and risks and what the different options would mean to her life. We're first gonna hear from her partner.
Elizabeth and I spoke with her palliative care team many times about what was most important to her. She wanted to be able to speak and use her voice for as long as possible, and it was also really important for her to see her son get married in a year. Based off of these priorities, our palliative care team helped us come to decisions that were right for her. She got a tracheostomy, which is a breathing tube through the neck that connects to the windpipe. And although this procedure was hard to adjust to, it allowed her to preserve her ability to speak for much longer. She also got a feeding tube so she could get all the nutrition that she needed to make it to her son's wedding. And in June, we were able to drive cross country in our van to see her son get happily married. I am so grateful for that.
And now we're going to hear about Emma. Emma is 68 years old. She has been battling metastatic breast cancer for several years. During her illness, her palliative care team was able to have many conversations with her and her husband about what she values. We're going to hear from Emma first, and then we're going to also hear from her husband.
I told my palliative care team that even while dealing with cancer, I'm still an Energizer Bunny. My family still calls me the glue that holds them together. I travel with my husband to visit family weekly, and being able to enjoy these visits are really important. I'm willing to keep doing cancer therapy as long as I can be physically and mentally strong enough to keep traveling and enjoying this time with my family. But if I'm no longer able to do those things, I think I would be ready to stop treatment. At that point, I would want to focus on being home and comfortable above all else.
At first, it was difficult for me to hear this, but over time, I really started to appreciate these conversations because I know exactly what she would want if her cancer worsens. I feel relieved to know that I am not making these decisions alone because she has already made her preferences clear.
For me, what stands out when I hear these is that the emphasis of how palliative helps with making decisions, no matter what these decisions are, and that sometimes we advocate for more procedures because they may be within someone's goals, and really our only goal in getting to know someone is, or our only agenda is getting to know someone and what's important to them, not trying to force any decision or route for a specific person, and it's very personal. Another thing in just thinking about all the different case examples that we heard is thinking about the diversity of illness that palliative sees, the diversity of age, and that we see so many different types of people and people from who have different illnesses, and that also we're there for the families, which has been reiterated throughout this presentation.
And someone wrote, I like hearing the partner's perspective as well, since they have to support their partners through their medical situation, which is such a good point. I think that's why so much of our role is really involving families and loved ones and encouraging our patients to share their thoughts, share their preferences with their families and the people that will be helping them with these tough decisions down the line.
Yeah, and we really try to, along those lines, we ask who's involved. Dr. Stepanyan and I actually saw someone this morning and arranged to have, a conversation next week to include 2 other family members. And I think that's part of the beauty of a palliative care team, where we do explore who's involved, who's important, who needs to be part of these conversations, and create time to have, these conversations, be it about decision-making, planning, or, just processing the impact of illness and how everyone is dealing with it.
Sorry, it might go backwards a slide for a second.
Okay.
For some reason, it does that. Okay.
And so we've described this service, and a question we often get, and not uncommon in healthcare, is who pays for this? What does my insurance cover? And it comes up fairly often, even for us that are inpatient. They ask, is this part of kind of the package? Is this the separate cost? So we wanted to make sure to address that in this presentation. So it is covered by insurance, like any other medical specialty clinic. So some of you may see other specialists, like a cardiologist or pulmonologist. It's along the same vein of that. There is SB 1004 in California. It's a California law that requires Medi-Cal managed care plans to provide access to palliative care. And that could be, just off the top of my head, HealthNet, LA Care. Those of you that may have a managed Medi-Cal plan, they have developed a carve out for that. And so it's, we mentioned this to let you know that it is covered. It may take a little, maybe communication or investigation with your insurance plan, but there is growing coverage. And so how do you access palliative care? This is a big reason of why we wanted to present to the community, to people like you, to give you the tools of learning how to access it, the language of how to talk to your family and medical providers about this. So this may come a referral from your primary care provider, your physician, or maybe your nurse practitioner. The referral could come from a specialist that you see. It can also come from a hospital medical team or emergency room provider. They may mention this, or they may put a referral in and you'll be contacted by a palliative care provider. You can search your insurance portal using terms such as palliative medicine, palliative care. We do want to caution, as you're maybe using Google or searching, a lot of times palliative care is coupled with hospice. Some agencies have their name and they say, blah, blah, hospice and palliative care. Don't be turned away by the word, hospice. They're agencies that provide both services. And it's worth exploring more and seeing what the insurance or the agency offers. And we really wanted to encourage you to be insistent if you want a consultation, if you want a referral to palliative care. Like Dr. Stepanyan was saying at the start of this hour, there are providers that are learning about palliative care. It's a fairly new field. People are learning about it, figuring out how it fits into their practice or into their medical care. And so sometimes we do need to be a bit insistent and press a little bit to get that initial consultation, and after which you'll learn more about how palliative care can be of benefit to you. And so some examples of what you can say to your provider are on this slide here. I'll read a couple to you. I saw this presentation about the benefits of palliative care during a serious illness, about how it helps people and their families get through it. Could you refer me to palliative care? Or maybe I went to a talk by a palliative care provider. Do you think seeing a palliative care team could be helpful for me? These are just examples to get you thinking about the language, the wording you might use with your provider. Some may be very receptive to it, some may not. And there may be a lot in between. I think one of the questions that we got in preparing for this presentation was, my provider may be already providing palliative care. And so hopefully in this presentation, you've learned more about this presentation and maybe have more or the services and be able to discuss in more detail how palliative care can be an extra layer of support for you.
And here on the slide is a list of resources of websites that further describe palliative care. And we will have these on a flyer that we'll be giving to cancer support community to give out to you all. Getpalliativecare.org is particularly helpful in finding a palliative care program near you, and also that matches with your insurance.
And I'll just add that on our UCLA website is also, we also have phone numbers listed for questions about inpatient palliative care services and outpatient services. So I think there may be some people in the audience that have tried reaching out and maybe got to the wrong person, but those would be the phone numbers to call.
And here's a map of palliative care clinics within LA County. They're not just UCLA listed. And this is not an exhaustive list. As Dr. Stepanyan said, this field is rapidly growing. And so the map will change over time. And just to note that these are physical clinics, that there is also home-based palliative care. And sometimes these are linked to a hospice agency, but they have their own palliative care portion or program that they also provide to the home. And here is some of the members of our team. As you can see, it's a big team and not all of them are photographed here. We have clinics in Santa Monica, Westwood, Westlake Village. We have people can come into clinic. They can also do telemedicine visits. And we have our team is interdisciplinary, and there are many different members on our team that are happy to be in palliative and wanting to have more patients.
So thank you all for your attention. And just to wrap up, our main take-home message is really that you or your loved ones or whoever you may know that's going through serious illness, you really don't have to navigate this alone. That the palliative care team, wherever you may choose to obtain palliative care in the Los Angeles community, can really help partner with you through a team-based approach. The main things we focus on are quality of life, facilitating communication with your other providers, and also providing support and guidance to make sure that you have a say in your care, that you have the information and support you need to make your preferences clear and to make challenging decisions that might come along the way. So thank you again. We do have some time for questions. I think we got through this earlier than we expected. So we'll leave the chat open for questions. We also would really appreciate if you could help us improve this presentation so that we can do a better job of raising awareness about palliative care services. So if you don't mind scanning this QR code maybe on your phone, or Edlin is going to post a link in the chat to our survey. It's very brief. We'll just take 2 to 3 minutes and it will help us improve this for future talks. So we'll leave this screen up for a bit for you all to have a chance to fill out the survey if you're willing to, and then we'll also answer any questions in the chat.
Perfect. Oh, go ahead, Lindsay.
Oh, I think someone's hand is up. If your hand is up, then sure.
We can unmute, so I just put it in the chat. If your hand is
Okay.
up, you can go ahead and write your question in the chat box, and then we can go ahead and ask it from there. Thank you so much, everyone. So we'll give everyone time to either scan that QR code or click on the link in the chat box to complete the survey. It'd be very helpful for everyone. I believe you answered, I think, the most important questions about what palliative care is. But I think we still have some few questions from registration. So I'm sorry if you did answer them, but let's go ahead and see. Somebody asked, how do you know when someone is a candidate for palliative care?
Yeah, that's a great question. It's hard to define that entirely. I think there's such a wide, we've kind of presented the main ways that we can be helpful, but we do see such a diversity, like we've mentioned, of diagnoses, of ages, and patients on different stages of their journey, like early in their illness course and later in their illness course. And so I think when there's a significant symptom burden, when there's a lot of kind of emotional or psychological distress related to the illness that they're facing, when there's kind of challenging decisions that they're struggling with, those would all be reasons why palliative care is appropriate. And there's no harm in at least coming for, if you're not sure, coming for an initial visit with a palliative care physician, a palliative care team. In that initial visit, we're able to really do an assessment and see if there's ways where we feel like we can add value, or if maybe your needs would be better met by other providers.
Thank you for that. Yeah, that's definitely great information, because I know everybody's situation is unique, so that makes perfect sense. For palliative care, someone asked, do you need a referral? Do you need to go through your primary doctor, or can they go directly to a palliative care clinic and just schedule an appointment?
I believe, and Delia and Lindsay weigh in too if I'm wrong about this, but I believe it does depend on your insurance plan. For PPOs, generally, my understanding is that you can often self-refer, whereas HMO plans, you do need a referral from a primary care doctor, your oncologist, or another specialist. Some insurance plans might not cover it right away, and there has to be a prior authorization that just needs time to process before it's approved. So it just kind of depends on your insurance.
Okay. Somebody asked, what are some of the, I guess, options? Someone said, what palliative care options are very helpful but less well known? If that makes sense. Like what, because we covered like the main things of palliative care and how they help, but like, what are the less known, I guess, like care treatments that people don't know that they can go to palliative care for? Does that make sense?
One of the things that, and I'm sure Lindsay and Dr. Stepanyan will jump in, that came to mind was people that are maybe undergoing active treatment, be it cancer treatment or other treatments where their pain and symptoms may change, that we can accompany them through that and help with that symptom burden as perhaps treatments or life circumstances are impacting their symptoms. People think if they're perhaps moving through some active treatment, can I involve palliative care? Is that disruptive at all? And we like to think that our practice enhances their experience, will make them able to tolerate perhaps treatments and interventions much better for them and their families, because the family, whoever is their family, they're watching, distress or someone being uncomfortable, it impacts them as well. So that's something that I think we get asked quite a bit. Can I incorporate palliative care if I'm actively involved in a treatment or an intervention? And definitely, I would say probably that's a point in time where we can make an impact on someone's life.
And I also think just in general, helping patients and families cope with illness, and that can come out in many different ways. And we do that in many different ways, whether that's a physical aspects, emotional, spiritual. We have chaplains, and also it could be helping with family dynamics, sometimes how to break difficult news to families, how to talk to their children. So we see a lot of different ways that we can help support families and patients, and how to communicate with others in their family, and how to communicate with doctors, how we find out how do patients want to be communicated to from their doctors. And sometimes us learning how they want to receive information is really important. And then we bring that back to their oncologist and say how they value communication. So there's a lot of different ways that we support.
That's great to know. I myself didn't know that. So that's really great information. Thank you. So we did get a few questions that came through in the chat, if you guys saw those. The first one was, does palliative care follow through end of life? And when does one transfer to hospice?
Yeah, that's a great question. Palliative care is often confused with hospice. And so I'm glad that someone brought this up. They are very different services. So most palliative care physicians like myself are also trained to provide hospice care. But they are different. As we mentioned, palliative care, we follow at all stages of someone's illness, whereas hospice really makes sense for people who are in the last chapter of their life. By definition, kind of to meet criteria for hospice, someone would be expected to pass away within 6 months if their illness runs kind of the natural expected course. And so sometimes people choose to enroll in hospice when they no longer want to pursue, for example, in cancer-directed therapy, maybe the burdens are starting to feel like they outweigh the benefit and they want to focus their time at home and being comfortable. That's when hospice would come in. Or maybe there's no more cancer treatment options because the illness is so advanced that the oncologist may feel like it's too risky because someone is kind of too sick to withhold chemo, and that's a time when hospice might make sense. And so we follow patients through end of life, but typically once someone enters hospice, a hospice team really comes in and provides the main bulk of the support in the home, seeing the patient regularly and kind of titrating medicines and providing equipment. As a palliative care doctor, I always stay involved with my patients, even when they're on hospice. But at that point, I'm usually not the primary one managing things, that the hospice team kind of takes over. Okay. And then I see some other questions here too.
Yeah. Did you want to go ahead and
Yeah,
answer?
can palliative care be used as a navigator to help with side effects of chemo and who to see? Yeah, that's a huge part of what we do, is helping with side effects of chemo. You know, if it's not something that we can directly address with medications, you know, sometimes we can be really helpful in helping patients navigate where to go, or maybe there's procedural options that would help with their pain. So we would be a good person for that. And then someone else asked, having a mental illness and cancer, am I a good candidate for palliative care? And yes, the answer is yes.
And if I could add to that, that's something that we see a range of emotional and psychological responses, and it manifests in a lot of different ways in, you know, anxiety, not sleeping. And we know that, you know, the physical symptoms and the emotional symptoms go hand in hand. It's a lot to navigate a serious illness. And so I would say more often than not, the patients and families that we see report some kind of concern in that area. And we'll kind of dig for it too. Are you sleeping well? You know, is your appetite impacted? That sort of thing. And so those things coupled, we do see, and then we can offer also referrals to support centers like Cancer Support Community, actually, Sims Man here at UCLA. It's just a matter of, again, exploring, as we were mentioning throughout the presentation, getting to know our patients, our families, and what the need is, and connecting them to our resources as well as other community resources.
That's great. Thank you so much for that. Oh, somebody asked, do you help caretakers with stress too?
Absolutely. Absolutely. That is something that that we look for and assess when we're meeting patients and families. You know, caregivers, how are they impacted? Is there caregiver burnout? Are they taking care of themselves? Because we know that they have this parallel process as well. They're feeling the impact of illness, and as much as we love our person, there is, you know, a level of burnout and burden that's to be expected. And so we hope and strive for that person to be taken care of as well.
Thank you. Yeah, thank you so much, all three of you, for this presentation. I know it's going to be such a great resource, especially because we are recording. So for everyone that's attending, this should be up hopefully within the next 2 weeks in our video library. And let me go ahead and drop in the survey link again. It would be really greatly appreciated if you guys can fill it out. It's a very quick survey. And also, if you have any direct questions for the presenters, you can definitely email us at info@cancersupportla, which I'm also going to put in the chat. And we can go ahead and get those questions over to the presenters. And then I believe Lindsay said that we are going to be sharing also a one-page resource with everyone today and anybody who registered. So thank you so much, Delia, Dr. Stepanyan, and Lindsay. We appreciate your time today and everyone who joined. We hope everyone has a great weekend. Thank you.
Thank you
Thank you
all.
all.
Appreciate
Thank
you being
you.
here.